Hey guys, thanks for joining us. I wanted to talk about engaging events. So many of you know that I've been having some formal events and educational events this past AEP with a couple of my downline agents as my guinea pigs. And what we were really doing was we were testing out our automations and our process, and they were lovely enough to be our subject matters. So we first started off with a carrier formal event. The carrier called me and said, Joanna, we need some applications for December 1st. Can you make it happen? And I like challenges, so I said yes. So our very first one, we launched the Facebook ad 3 days before the event, and Zach showed you last week exactly how he did it. He gave away the house, the farm, the yard. And so I want to talk about how we built the entire event outside of the technology. So when you're conceptualizing an event, I think the very first thing is you have to know what your goal is. So are you, and who your target audience is, because that's going to dictate what type of event you're going to have, what you can offer them, where you're going to have it. So we wanted to do a formal sales event. Because it was a formal sales event, I was limited by my budget. I can't provide people steak and lobster for a formal sales event. And I was going after people already on Medicare because I needed immediate enrollment. I wasn't trying to wait until next June to get an enrollment, right? So I wasn't going after T65s. I was going after people already on Medicare. And I wanted to present a particular carrier specific to this region. They are only in 3 counties here, so it was really localized in the demographic. So knowing that, and then thinking about, man, it's in the middle of AEP. This product is new to this place and not a whole lot of people know about it. How can I position this as a winner? So I got the actual flyer for the plan approved to be a part of the Facebook ad, as you guys saw with Zach working on it last week. So on the landing page, they saw what we were really going to show them. They knew exactly what they were coming for. It was a $0 specialist, $0 hospital, and low max out of pocket for the chronic illness, for diabetes and COPD. The max out of pocket kind of resembles, some Florida counties, some Las Vegas counties where it was $1,099 for the max out of pocket, which is crazy, right? And so people came. We had, I think, 10 attendees, all on Medicare. And we had 9 out of those 10 enroll into plans. Now, I call that a success, right? 9 out of 10 enrolled in those plans. And the only one that didn't, we get her back on the phone because a lot of people don't answer their phones these days. So that we're going to talk about that. The other event we did was an educational event at a venue that I've never used before because it wasn't my forte, but I said, hey, let's try it, right? And so I want to talk today about how to set it up. So the first one, the formal event, I said we can't serve lunch. We can't serve dinner, but I do need like a kind of public area that's not, I didn't want to do it tied to a doctor's office because we had very low response rates on those. When we tried to partner with the doctor's office, people were like, oh, I already love my doctor. I wanted to do it where everybody would come, regardless of, doctor affiliation, church affiliation, gym affiliation, And so we chose a restaurant that's known for their pastries and desserts. And we offered, we had it at 2:00 in the afternoon, so lunch was not expected. And we said that come have dessert with us, basically. So planning and logistics are crucial components to any successful Medicare event. We must pay careful attention to the venue selection, accessibility, and overall flow of the event. The meticulous planning not only enhances the attendee experience, but also reflects on your professionalism. By ensuring that every detail is accounted for, from the seating arrangements to the information and materials, you really promote and the vibe of the event. Have you ever walked into a place and the vibe was just off, everything was scattered? You don't want to do that. So one of the things we learned from our event at the pastry place was the didn't start serving drinks and the desserts until we were like presenting. And I had a real big problem with that because first she came in with a tray and there was stuff everywhere. So I was like, never again will I allow them to bring it while we're already in the middle of a presentation. They wanted to wait, and I should have had them already bring it before people got there. So that was on me. I also should have had the drinks and everything already brought before we even started. We learned that for the second place. Before we started on the second event, everybody had drinks. Everybody had their food. We waited until everybody got back with their food on the second one that we were serving food at before the presentation started. So we learned lessons, and as you do stuff, you're going to learn lessons. Nothing is ever perfect from the beginning. If you can have a very perfect event on your first event, man, I want to copy you. But we learn things about, oh man, I wish I had this. I wish I did this differently. So I think the very first thing is, and it doesn't have to be in your backyard. You can do an event across town in a different county. I mean, I lived in Atlanta and did events 2 hours away because that was where my honey hole was. That's where I felt the most comfortable. You don't have to do an event in your backyard. You know, one of my agents here in Houston was looking for a venue space within like 5 to 10 minutes of her house. I said, go somewhere else. Go find a venue somewhere else that's more comfortable. Your do not have to be your neighbors. We can go anywhere within driving distance, really. You know, so if there's a famous cake place or a pie place here in Houston, I am dying to try it, and I think that's going to be my next event. But I'm concerned about doing it for the diabetes one, so I have to pick a different product. But I want to do it at a pie place because I can serve dessert and coffee, right? So I'm going to be next door to me. And so think about things like that and having some ambiance and what you're going to present. Think about having your presentation done and what you need to present. So you need more than a laptop if you're going to put it on a screen and keep everybody's attention. Jeff did a fantastic job. He had a projector and he had a screen for his projector, and they were not very costly. And I think that every insurance agent should have these by their second year in business. They're not very costly. If you're concerned about the cost, ask for these items for your Christmas and birthday presents. Christmas is coming up. Say, hey, this is my Amazon wish list. Please buy me a projector, or buy it used from somebody else, or ask somebody to borrow theirs. Many people will loan it out. We had the materials. Now, we were presenting for the very first one, we were presenting a carrier plan. So we had all the carrier materials. Jeff went and got paper materials from the carrier's office, and we made sure that we had more than enough. So we weren't going to run out because we wanted people to bring their friends. We wanted people to bring spouses. So when you do like a Facebook ad, I might respond, but I might bring a boyfriend. I might bring somebody. I might bring my neighbor. So one person might respond, but they're usually going to come with a spouse or a friend, because a lot of people, especially for food, they want to make it a social interaction. And that's fine. We want people to bring friends. It's cheaper marketing for us, right? And we encourage them to bring friends and spouses, because a lot of people won't do business without their spouse seeing it too, right? So we want people to bring their spouse. So if I get 5 Facebook leads, I'm assuming 10 people are coming. One thing you need to do when you're planning your event is set a budget. A lot of insurance agents try to do this business on nothing. They don't want to spend any money, but they want to make money. We get paid pretty well, but it either takes time or money. And when you're in the middle of annual enrollment, or you're trying to gain some momentum, you don't have a whole lot of time to pay the rent, pay the mortgage. So if you can spend a couple $100s to get a couple enrollments, you're going to be in the green. Think about it. If we get paid about $300 per person for a January 1st renewal, right? If someone goes from one carrier to another with you under a different plan, or plan to plan, like if they go from an HMO to PPO, whatever, or one PPO to another with the same carrier, you're going to get paid about $311 for a street level agent, plus renewals. So that one person who you might have to spend, I don't know, we spend about $10 a Facebook ad per person. Plus, I spent $70 on the desserts. So $70 divided by 10, that was about $7 per person. I had leads for less than $20 for the lead plus the person sitting in the seat. Less than $20 a person sitting there, and we closed 9 out of 10. That's not a bad ROI, right? Think about it. Even if we had closed 2 out of 10, I still would have been profitable. So you want to set aside a budget. Now, some agents might find it beneficial to work with somebody who has a similar interest in those clients, like a doctor's office or a financial advisor. The only thing is, when you work with a doctor's office or a financial advisor, sometimes your purpose might get overshadowed by their purpose. That's why I didn't want to work with doctor's offices at this time. We work with doctor's offices all year long, like Oak Street and Centerwell and Archwell, like we work with them, but if they're paying for it, then they become the star of the show. I didn't need or want anything else but Medicare to be the reason that people came or to divert attention. I wanted the agent to be the star of the show. I wanted it to be, very simple, clincher. But sometimes if your budget is, thin, you can, partner with one of those folks and maybe have them pay for the dessert, or maybe have them pay for the Facebook ad spend. Usually they should pay for at least 50% of it, but I was willing to pay for 100% of it just so we could launch it fast, because the more people involved, the farther out you have to plan and coordinate. Another thing we did is I wanted to make sure we were in a private room I had to be able to close doors. I had to have, be able to have accessible parking, handicap seating, and things like that you have to consider when you're having a Medicare event. It's not like having something for like ACA or something where it's going to be younger people. I also wanted to make sure I was going to have enough room, because if I needed room at least 15 on the first one. The second one, I wanted at least 30, right? And so I needed a room big enough to hold, and I wanted to make sure that the venue was appropriate. So those are things that we had to consider. Some other things that we considered is the advertisement, what is going to draw people's attention. That was a big thing, because I was like, and that's why we did, one of them was at a Golden Corral, and we offered a senior lunch, and we had a deal with the Golden Corral. It was $11.99 per person, which is perfect under the $15 limit for education, and included their drink. And so that was perfect. I knew that offering a free lunch would fill the room, and we filled the room. Not everybody was there to be intentional to learn about Medicare. Many of them had been on Medicare for 20 years, but we filled the room. And that was the purpose during an AEP, is to try to get as many beneficiaries as possible at the very last minute. We were doing it right before a holiday. So we fulfilled the purpose. Some people were just there for the free meal, and you're going to get that when you offer free meals. Some people are just going to come because they might not have anything else to do. One of the beneficiaries there told me that she sees a couple of these people at a bunch of them, and so she admitted that she goes to a bunch of them to get the free meals, right? Another thing is giveaways. Having something that people can interact with you while you're presenting, maybe to earn it. One of my agents does this with bingo. He gives away bingo prizes, right? Not a bad idea if you can, incorporate that with your event to have people raise their hands and answer questions. So it's not just you at the front, wah, 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 right? So if you can get people to interact with you, and the best thing to do is tell stories. Explain what a max out of pocket is in the most catastrophic way. So when I'm giving a summary of benefits presentation, I am very animated. If you can imagine, I say, okay, your max out of pocket, worst case scenario, if you're hanging Christmas lights and you fall off that ladder and you break a bunch of stuff, and the ambulance has to come get you, or maybe you're life flighted to the hospital and they decide you need to stay there, and then you have to go to skilled nursing home, that's where you're going to meet the max out of pocket. Earlier this week, I used the example of if you're in Alaska getting chased by bears. Make the story memorable. You can exaggerate, but a lot of it's not, life happens, right? I use things like that because people will start chuckling because we're hanging Christmas lights now. It's the beginning of the Christmas season. It's relative to what they're thinking about, right? I tell a story, so I'm not just saying, and the max out of pocket is this, and the inpatient is this, and if you have an MRI, it's this. I tell the story, so if you get ambulance, this is this out of pocket. So you're not going to pay more than $1,099 despite all of that happening. What do you think about that? I'm asking them for their feedback because they're going to be like, oh man, because they already think that the ambulance ride and the MRIs and CT scans are already going to cost them an arm and a leg, and they're going to have to refinance their house, right? So tell a story. Tell them. So when you go see Dr. Jones over there on the corner, he's usually a primary care doctor, and it would be a copay here. Now, if you go see, just pick out doctors in the area if you know of anybody. Ask them, who's your doctor? Do you have a doctor, rheumatologist, cardiologist, endocrinologist? Okay, when you go see Dr. Jones, it's going to be this copay. Now, who has to have a colonoscopy this year? Okay, if it's this, it's going to be a $0 copay or whatever it is. Most colonoscopies are now $0 unless it's diagnostic. If you have to go get your diabetic screenings, it's this. Now, who's got fancy dentures? These are included. And start telling stories and using examples of what's included in the plan, because that's how people actually relate and start recalling what you said. Because they're going to hear oh, well, Joanna said that if I fell off the ladder, the air ambulance was going to be this. They're going to remember that. They're going to say, oh, yeah, Joanna said that if I wanted a brand new smile, that it was included. She also said that if my spouse drove me nuts during the Christmas holiday, that mental health was included, right? And so tell stories and be animated. Borrow somebody else's personality if you don't have one. I had to come out of my shell. I was the shyest of the shy. You'll probably hear me tell this a million times. But when I worked and had a table at Walmart and I needed people to come over and talk to me because I couldn't talk to them, you have to be animated. You have to draw them out of their shell to get them to interact with you. You have to ask them, about themselves. You have to give compliments. Now, don't lie. Don't tell someone that you like their lipstick and it's all over their teeth or whatever, Don't tell me I look pretty and I'm not the prettiest, right? If someone's wearing something that you can relate to, like a sports jersey or military paraphernalia, engage with that, right? People resemble what have affiliated with, right? A lot of us will wear our own paraphernalia, right? Just like that. So engage with them. Find a reason to be personal. Ask them, are you from around here? Did you grow up here? Do you go to church around the corner? Because you also want to find out where their activity is to see maybe if you can do a presentation at their church. Oh, you live at the senior building down the street. I wonder if they have an activities calendar. Oh, they do. Do you think that you can help me talk to the activities manager? You want to find out where they work, where they live, things like that, because that's a way for you to actually engage with them more. Find out something about them. When I was at Jeff's event last week, I was talking to the folks over on my side of the room, and I found out everything that they had going on. One lady told me she was on a give back plan, and she really wanted a give back plan. She liked this, but that $174 a month, was a big deal to her. Now, there's more than one give back in our area, but I annotated that for the agent. I said, has. And so he knew what was important to her when he called her back, right? The other lady told me she had a spouse at the house. And, she just engage with them. Find out about people. People like people who are interested in them. If you ignore people and just wait until they sit down and be like, okay, who's here for class, right? If you ever went to, college and you had an engaging professor, think about what made it not fall asleep in class, right? You don't want someone just pointing at the board. And Medicare and dentures and vision. Insurance is not sexy. but we can make it sexy. You can make engaging. People are there ultimately to find out how you or this plan, if you're presenting a formal plan, are going to benefit them, right? Everybody wants to know what's in it for them at the end of the day. So you have to give them, this is what's in it for you. And you have to make it engaging so they're not falling asleep and, walking out there going, I don't even know why I came today. So there's some things that I think you should have. You should have a laptop connected to an HDMI cord and a projector. And if you have a fancy projector screen, they're not expensive. You can ask for it on your Amazon wish list. Maybe somebody will give it to you for Christmas. You should have that. You should have a box of pens. You can get a box of pens at Walmart, something like that, for about $5. You should have at least 20, right? Maybe some Carrier branded pens. I would do my brand pens if I had a budget beyond $5. You can do your own pens on some of these promo websites, like All Promos, for like 50 cents each. It's cheap. And guess what? Pens go home with people. They look at them and be like, this girl, Joanna, had the prettiest blue eyes, right? They carry it with them. Pens are important to people. I would have appointment scheduling signage. I like to do the 8x11 clear acrylic sign holders. It's usually picture holders at Walmart. You can usually get it for $2, a dollar store. Have your Calendly link there so people could just schedule an appointment. If you're allowed to ask for appointments. I mean, if you're not, you could just have it in the front. If people scan it, it's on. But during a formal sales event, I can ask for the sale. And so you don't want to be at a formal event and see the amazing benefits and then collect a business reply card, which you should have, and then try to get them back on the phone, especially at the last week of AEP. Like, we're having another one this week on Wednesday. The end of AEP is Saturday. If you're seeing me Wednesday, we need to see you Thursday, Friday, or Saturday. I don't have time to get you back on the phone. You're in front of me now. You know what time you're available tomorrow. I mean, most people that are coming are retired. Maybe they have a doctor's appointment, but one appointment is not an all-day thing. If they have their doctor's appointment at 1 o'clock in the afternoon, I can see them at 9 o'clock in the morning. I can see them at 7 o'clock in the morning if they really want to. I don't even have to see them kneecap to kneecap. These already see you. Guess what we should be doing? I can do it by phone if you have a smartphone or an email, or if you're really savvy, many of the carriers have voice signatures. You don't have to drive to their house. They already know how pretty you are. They already know how handsome you are. And I make this joke. I say, okay, Ms. Jones, you already know how pretty I am. I don't need to come see you, and you don't have to clean your house. You don't have to, get out of your pajamas. We can do it over the phone. I just need your prescriptions and doctors to make sure that they're in network. If you fill out this link right here, and I have software on my IMO platform where they can scan my QR code. It goes to the permission to contact, and then it goes to their doctors and their prescriptions, and they can even book on my calendar right then. I said, if you fill out that, I'll be all ready for you, and I'll be out of your hair faster than you know, because they already saw the plan, especially if it's a registered sales event. Saw the plan. You already did the presentation. We just got to do paperwork. You can do paperwork right there if they have everything and they're ready to do it. It's hard to do paperwork right there and not talk to the other people there. Your purpose there is to get appointments, not to do one application and ignore the other 10 attendees, right? If everybody wants to do an application, have applications. They can fill out their information. You can do paper applications. If you have enrollment guides, have them do, if they're ready to sign up, have them do it right there, especially if they're on generic medications like metformin, atorvastatin, amlodipine. Like, we all know those are on formulary. You can, simply control F PDF and look up anything like Manjaro, Ozempic, right? But you can have everybody fill out the present application right there in a formal sales event. That's what we used to do, old school. You don't have to have a one-on-one unless they really need to look up drugs and doctors. And some may, but at least schedule the appointment. Worst case scenario, everyone should have a scheduled appointment before they walk out of a registered sales event. They should have a registered one. If they need to go home and talk to a spouse, that's fine. But put me in your phone so you know that I'm not calling you. I'm not someone calling you from India. And I say that. Say, hey, save my phone number, and I have them save it, and I'll even text them. So, my contact information comes up, or I'll have them text me, say, save my number, save my information so I'm not spam. Because a lot of people are going to forget by the time they wake up tomorrow who you are, or they're going to look at your phone number and be like, I don't know who that is. That's because they're spoofing all these phone numbers, or all these call centers are spoofing local numbers. So a lot of people aren't answering their phone anymore. It's 2024 going to 2025. Unfortunately, that's the times that we live in. So if someone's going to get back with you, have them save the number that you're going to call them from, whether it's your VoIP, if you're going to call them from your cell phone, if you're going to call them from your dialer, from your Go How level, have them save that number that you're going to call them from so you can actually reconnect. Another thing, one of the things, so Jeff was really lucky to have me there. I mean, I'm great to have and everything, but one thing that I suggested to him when I'm not able to come and, hold everything for him is to invite either a relative or a current client who is his cheerleader. Hey, buy your current client some dessert. Let them have a free lunch if you're doing it educational. But having someone in the room being your cheerleader saying, oh yeah, I work with Jeff. He's amazing. Look how handsome he is. He knows everything. I see him every year. He's always taking care of me. Someone in the room edifying you goes way more than anything else. And it also helps to have control of the room. At the educational event we had, I noticed that someone in the back of the room was trying to sell supplements. It was the craziest thing. I'm like, is this person at my event trying to solicit the people in the back of the room to buy? It was like garlic or something, garlic supplements from her. Like, it was crazy. But if you had someone like your mom or a favorite client that's local to you in the back, and they can ask questions, hey Jeff, does this for Ozempic? Why, yes, Joanna, this plan covers Ozempic, and guess what? It's a tier 3 medication on this plan, and tier 3 by mail order is only $60 a quarter. Can you believe that? Because they asked the question, I can respond like that, right? Having them ask questions, especially if the room is dead and not engaging, if somebody is there engaging with you, you try to find the talkers in the room because you want engagement. You don't want just everybody sitting there going, right? So bring a friend, and everybody doesn't have to know that they were especially invited, but your current clients can come to these events, especially if you need to see your current clients to possibly rewrite them and move them out of a plan that's leaving the county or might not be suitable. They should be coming to these events, because the more time you can save by them coming to you, hey Jeff, this plan looks great, sign me up. All right, we can do it right now. Click, 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 done. Saved yourself a whole lot of time by trying to drive an hour to somebody sitting in their living room making small talk about their kids and their grandkids and how their Thanksgiving was, by having them come to your event, right? So invite your current clients out to your events, especially if you need to see them, to engage with them. Another thing you should have is an event banner. So when we were doing the formal sales one, we went to the carrier and got some banners from them because we wanted people to recognize how to get to our room. I was standing out in one area at the Golden Corral, and we were directing traffic. Chanel and I were there directing traffic to Jeff. I can't imagine if it was just Jeff by himself. People might have been at the front not knowing where to go, and maybe they would have paid for their own lunch by accident because they didn't know that they were part of us. So it's always nice if you can have somebody to come along with you. They don't have to be a licensed agent. It could be your 15-year-old child that's out of school. It could be somebody else, maybe your next door neighbor who just wants to get out and have lunch. You can enlist help of anybody for an hour or two, right? Another thing that we learned is show up really, really early. If your event is at 1 o'clock, you should probably be there at like 11:30 because people are probably going to start showing up at 12:15. So be there early to set up your table, your projector, your laptop. Make sure that the wait staff is bringing the drinks and the desserts or whatever you're doing before when people come in. So people aren't sitting there for 15 minutes waiting on their drinks and you are trying to present. One of the assets I created for Jeff was a simple signage for scheduling appointments, and we put this all around the room and on the with his branded tablecloth. But what we did here, let me zoom in, this QR code, and I teach people, okay, you're going to take out your phone, turn on your camera, you're going to scan this, and a website's going to pop up. So they can scan this. They can also go to his website and everything. But this goes to the URL. So this is mine. Mine goes to my permission to contact on my landing page. If somebody puts in this information, then it goes into my contact. Then it goes into my needs assessment. And then when they go finish my needs assessment, they get an email to schedule on my calendar. So it's my entire funnel. And then when they do that, it goes straight to my CRM and it pops up with an email, text message, and a reminder for me. So they're already in my system and I have everything I need so I can do business right there. Like if they're filling this out while we're talking, I already have all their information. I can go into my CRM and actually just click enroll, check their gender, you know, their English, etc. And we can hit enroll right then face to face. So this actually saves a lot of time. Using technology, even if it saves you seconds adds up to minutes, adds up to hours. My minute is calculated about $16 a minute. So every minute I save, I'm putting money in my pocket. So you can create this. Anyway, you can have just a Calendly link QR code if you don't have any CRM like we do. But you can create a landing page if you have Atomic Automations or another CRM that has things like that. And you can work smarter, not harder. So this is what we did. And they can schedule it right here. Now I'm sorry, you didn't see my screen. 1 second. Let me add it to my stage. Sometimes I forget when I'm flipping screens. All right, this is my landing page. So when someone fills it out, they put their name, email, phone number. It's a permission to contact. When they click submit, it's going to go into my needs assessment, asking them about their prescriptions and their doctors. And if they fill it out right there, it'll also go schedule on a Calendly. But if they fill that out and it comes straight to my CRM, I have their address and their information, and it saves me time. That's how you can do 10 people at the same time, because they're just going to click enroll. If they're filling it out, you can go to your Pearl link if it's a product on right. So everybody can enroll then electronically. If you don't have paper apps or you don't want to go home and scan apps, you can tell people, okay, fill this out. Then we're going to go here. And everybody can do an electronic Pearl enrollment. It's completely compliant because you gave the presentation on a formal. So that's one way to work smarter, not harder. Now I want to show you the handout that we gave. Present. Now, I thought this was pretty smart. Many of you have seen my agent resource guide. I created this for consumers, and it has how to contact him, what's in this, right? Because I want them to take this home. I want them to put it in their dresser drawer. I want this to be, they're not going to throw this out, because watch. First, it has the Inflation Reduction Act information. And it asks the questions I want them to think about. Are my prescriptions still covered on my current plan? Has the premium of my current plan changed? Is there deductible on my prescriptions? Those are questions I want them to be reviewing, because if they say, I don't know, well, that's a reason that they would need my help, right? I want to also talk to them about the payment plan. People don't know about this. If they have a prescription deductible, which could be $590, that's a lot of money in January that many seniors may not have. I want to tell them about their options and how to do it. I went over the 2025 Medicare costs. A lot of them didn't know that the Part B went up to $185. I also cover things that most people don't cover. Most educational seminars that I've gone through skip over so many vital things. They talk about A, B, C, and D, and med subs. Joanna does not talk about A, B, C, and med subs and calls it a day. Y'all know me. I am nosy. I want to know everything about you so I can know every way I can help you. I want to know if you made $300,000 last year and then you stopped working. Because guess what? I can help you file an SSA 44. Here's my IRMA chart, right? Here's my SSA 44. They can scan that right there. It's information. And the reasons why they would need to scan this: did you have a death of a spouse? Did you have a marriage? Did you have a divorce, a work reduction, a work stoppage? loss of income producing property, loss of employer pension, receipt of a settlement. These are reasons people would need to file a change for their IRMA. And I've encountered this from my educationals where people are like, I'm not paying 185, I'm paying, and they list an IRMA amount. They're saying, I'm paying 370. Why is she paying 185? Okay, how much did you make in 2022? Well, and this tells them right there. So we're not guessing. I also want to know if they qualify for Medicare savings program. And I have the QR code right here to every state. So if they're saying, well, what about my cousin who lives in New York? Well, they can look on that right there and find out what New York qualifies for. So, and right here, a lot of people sat there and said, well, yeah, I'm under this $1,715. What does that get me? And I said, we can help you apply for the Medicare savings program. As long as you're under the assets, you get that 174 or 185 in January back in your bank account. I helped somebody earlier this week do it. She got her letter really fast. Do you qualify for extra help for Part D? I have my own income chart made with the resources and what levels they may qualify for, and the Social Security website right here. I want it to be educational. Another thing that we're adding that I want to show you. Let's see if I can bring it up. I'm going to remove this. My partner Zach made this for me. I want people to know that an MAPD alone might have some gaps in their coverage. You want the consumer to tell you what their drug coverage is. Oh man, it's fine. It covered all my drugs last year. It's going to be good next year. We know that that might not be true. What kind of hospital copay are you looking at on your plan that you have? Most people don't know. They don't know if it's $250 a day, 1 through 5, or $375. They don't know. That's an opportunity for you to do something. That's an opportunity for you to offer additional coverage. Most people don't know that chemotherapy on most Medicare Advantage plans is 20% up to the max out of pocket on most plans. They don't know that. Most people don't consider home health care. So this is a good checklist for you to have. And I'm going to put this in the files for you to go through with people when you're doing a presentation, when you're doing an appointment. You want them to know, does this plan have dental coverage? If it doesn't, and that's the right plan for them, they can buy separate dental coverage. There's no law that says they can't have a Medicare Advantage plan and a standalone dental. They can have a physician's mutual dental. They can have an emeritus. They can have what they want. So this is an opportunity to find for them to really realize and engage with you on what they actually have. Because most people, if they don't know this, they're going to go home and look at their current plan. Or you can say, do you have your card on you? I can look at your current plan and show you, because you can pull up Sunfire and show them what they currently have. They say, well, what is my drug coverage on my plan right now? They're asking you, right? So this is what we're doing. And let's see. I felt like this was the clincher, because this is going to get people to think about what they really have versus what they really need, especially when they flip through their summary of benefits and they look at that hospital copay and they might go, I didn't know it was $350 a day, 1 through 6. That would cost me an arm and a leg just to go to the hospital, right? Well, there's options for that, right? I didn't know that the dental went away on this plan. I need to get a crown next year. There's opportunities. So when you have this discussion, you want to book the appointment right then, right? You want to ask them, Ms. Jones, you like this plan? Perfect. It's 3 o'clock now. I have another clock appointment after this at 4. I actually have a 7 o'clock available, or I can see you tomorrow. We can do it by phone. You don't have to clean your house and get ready for me. I always make it into you don't have to see me to do business with me type of thing, because I can see everybody in that room tomorrow morning faster if everything's by phone. We already did the presentation. I don't have to record it. I'm just getting them to double check their doctors if we need to. We can do business right there in a formal sales event. If you have folks who are savvy, who type in their name on their phone and do this. Now, to HMO, they have to pick their doctor out of the network. So that might take a couple seconds to look up the doctor's MPI, right? But you can do a registered sales event and go home with 20 apps. It's about how prepared you are to do that. The more prepared you are, the more business you're going to close at the event. And like I said, I would not just go to the event by yourself as Joanna, the solo agent. I would bring some helpers, even if they're unlicensed, even if it's your mom, even if it's your next door neighbor, even if it's your 10-year-old on a Saturday. I would bring some helpers so you have people engaged. While you're talking to him, they're talking to them. And you can do events and get, you might spend $300 to make $3,000. That's a good ROI, right? And the more you do it, it's a numbers game. One event isn't going to make it or break it. You need to build the momentum. One of our agents had an event every day this AEP, sometimes 2 events. He was at one place in the morning, one place in the afternoon. And that's how he's about to hit 150 applications this advantage, not even the supplements in life that he written, because of the momentum. So if you start planning it, maybe you do something at a senior center, maybe something that doesn't cost a lot of money as a venue. You can bring lower cost items. I suggest coffee and dessert because it feels like coffee and dessert. Like, who wouldn't want to come for cheesecake? And you can get a cheesecake from Sam's Club or whatever. If you're doing an educational event, we did pizzas from Sam's Club. It was like $8 for a massive pizza. We did that at a couple of apartment complexes and stuff. And that was a really cheap educational event. I think the more serious folks come to the registered sales event, especially if they see the ad that's approved. Let me see if I can pull up the ad that I showed you. One thing I wanted to show you guys is if you're with me in your Spark marketing, how to do that QR code. So anybody who says, hey, Joanna, I have a referral for you, I go into marketing and then go to sources and I create a new source right here, add new source. So let's say I'm going to have an event. I'm going to have Panera Bread. I'm making the source. So here's my URL. Here's my QR code, right? And just downloads, right? But when people scan this, I can actually see I'll be able to see all the people who scanned this and filled it out. Well, not scan it, but I'll be able to see the people who filled it out. So back here on marketing, if you don't have assets, we do them for you. Now, they're basic, but they're already done, so you don't have to go figure it out. So if you need a Medicare 101 presentation in your branding, here it is. If you want one without any branding, here it is. If you want flyers, here they are. If you need a business reply card with your branding on it, you could just download that and print it. Event mailers, business cards. If you haven't done any of your business cards or anything yet, you could just come over here and download it. We do both English and Spanish. You see how it just translated that for me? Beautiful, right? You see how my presentation just turned to Spanish? And I know my Spanish agents are happy about that. But these are already done for you. And you can come over here and edit your profile if the information's wrong. You can link it. Yeah, so make sure you use this stuff if you don't already have it. The permission to contact forms. I don't like to use carrier branded stuff all the time because I want to know. So at the Foremost sales event that we had, not everybody went with the plan that we presented because sometimes it's not like the right fit. Like if I can't find their doctor and they have current stuff going on, like a surgery coming up in January or maybe the current medical treatment, and their doctor's not in network, I'm going to find a different plan that fits them, right? And that's what we do. I tell everybody at these formal events, I work with everybody in Harris County. There's not a carrier here that don't let me work with them. I even got Community Health. I even got Verta. I got them all. There's not anybody here who doesn't let me help them help you. So regardless of your needs, I can help you find a solution. So if this plan didn't float your boat, I can help you find a plan that does. And that's what you need to make sure. That's why I don't use carrier branded stuff. I want them to be there for Joanna. I don't like to give them a carrier pen. I want to give them a Joanna pen, right? Because me giving them a Humana pen, even if they're free, well, now they're picking up a Humana pen. They're not remembering the blue-eyed girl that gave it to them, right? So I want my stuff branded. I want my tablecloths there. If I'm giving a presentation about a carrier, I'll have their stuff there too, but I want to pay for my own stuff, because your own branding, we don't get paid to market for the carriers. I don't work for United Healthcare or Humana. I want people to remember Top Flight, right? And so that's why I want my stuff. I'll pay for my own branded stuff, my own business cards, not the free ones that, one of the carriers gives me. I want my own stuff. Might cost a couple dollars to get these done, but it's worth its weight in gold. So I wanted to show this to you guys. Let's see. I think the most important thing is, after you do all this effort, you advertise it, you get all your supplies, you do the presentation, make sure you have a personality and make sure you ask for the business. You can't just say, okay, guys, thanks for coming. If you need any help, my name is Joanna. Give a compelling thing, and if you have other events, say, if you enjoy today's event, come have ice cream with me. Whatever your next event is, give them a reason to engage with you. I tell people, hey, if you have Instagram, Facebook, add me on Instagram and Facebook. I put out a lot of content. I put out a lot of stuff. Have them interact with you, because you don't want the lead that you just did all that work for walk out the door and never engage with you again. You want them to follow you on social media. You want them to continue to engage with you. They might not be a customer today. They might be a customer next year. They might be a customer in 4 years. I have people that I talked to in 2018 at Walmart call me, hey, I remember talking to you at Walmart, and I didn't need to change then, but Humana just left Tanner Hospital and I need to change. I'm getting those calls because people kept my stuff and they've been in contact and engaged with my stuff. That's what engagement is. So you want to have them engage with you somehow. Have a social media. Ask them if they want to sign up for your newsletter. Get their permission. If they did a Facebook ad, you have their contact. Just verify the email and everything, and continue to engage with them. Don't let them walk out the door and never talk to them again. Send thank you emails, thank you text messages. Continue to engage with them, especially if they didn't book an appointment, because sometimes people might have already made a decision, or maybe they didn't have all the information, or maybe they have stranger danger. Sometimes people need to engage with you for a little while before they feel like they can discuss what's really going on, but give them a reason to engage. So have your social media flyers out. I hope that many of you have TikToks and Instagrams and in channels now. I hope that you guys have realized that it's 2024. Everybody's online. Continue to have them engage with you, a YouTube or whatever. You don't have to discuss rocket science. You just have to be engaging and borrow someone's personality. If your personality is dry and boring, think about me. Think about Scott Sims. Think about somebody who you respect and borrow their personality. All right, guys, that's it for today. I hope you guys go. Guess what? You can do a CSNP event year-round, 12 months out of the year. We're doing CSNP events next week after AEP. There's nothing that stops this roadshow. Like, just because AEP is over doesn't mean people are still not needing help. There's SCPs out there. There's chronic plans out there that you could sell up until December 31st for January 1st. I can continue to sell CSNPs January 31st for February 1st. There's people who just moved. There's people who just lost Medicaid. There's so many SCPs out there. There's people who have weather SCPs up there in Ohio who just got slammed with snow. There's SCPs everywhere. Continue to have your events. Just because AEP is wrapping up doesn't mean that we go to sleep for another 9 months. Okay, guys, go ahead and get it. Bye-bye.
That's a wrap. If this helped you close more deals, hit follow. New agent training drops every week only on Top Flight Insurance.